Willowbrook Medical Center was one of the top-rated hospitals in the country, known for its state-of-the-art technology and commitment to providing compassionate, inclusive care. It was a place where patients from all walks of life came to receive treatment, and where diversity wasn't just welcomed, it was celebrated. The hospital's values were clear. Everyone deserves respect, empathy, and dignity, no matter their background or beliefs. So when Dwayne "The Rock" Johnson, one of the most famous people in the world, walked through the doors, the staff expected a smooth visit. Nothing out of the ordinary. The Rock, standing a towering 6'5" with his trademark charismatic smile and undeniable presence, had come to Willowbrook for a routine checkup. Dressed in a simple black t-shirt and dark jeans, he looked like any other patient. But one thing quickly set him apart: the baseball cap perched atop his head. The hat, boldly emblazoned with the phrase, "Make America Great Again," was unmistakable. To some, it was a harmless piece of memorabilia. To others, it was a controversial symbol of political division. Kelly Thompson, the hospital manager, was among those who didn't take kindly to the hat. She had worked at Willowbrook for over a decade, and during that time she had been deeply committed to ensuring that the hospital remained a safe, inclusive space for everyone. In her mind, a MAGA hat represented everything that ran counter to those values. It was a political statement, one that could divide staff, patients, and visitors alike. And in her role as manager, she believed it was her duty to maintain a welcoming environment for all. As soon as she spotted The Rock entering the hospital lobby, her heart sank. She knew immediately what the hat meant, and she couldn't ignore it. Despite his larger-than-life reputation for kindness and generosity, she felt it was her responsibility to enforce the hospital's policies, no matter who the visitor was. Without wasting any time, Kelly approached him, trying to keep her voice calm and professional. "Excuse me, sir," she said. "I'm going to have to ask you to remove your hat. We have a strict policy against political symbols on the premises." The Rock, taken aback by the directness of her approach, paused for a moment. His warm expression flickered for just a second. But he quickly masked it. He looked at her and then at the hat before responding. "I understand your concern," he said, his voice deep and measured. "But I'm here for a routine medical appointment, not to stir up trouble." Kelly's gaze hardened, her resolve firm. "I'm sorry, but it's hospital policy. We cannot allow any political messaging that might disrupt the hospital's atmosphere of care and healing." For a long, awkward moment, they stared at each other. The Rock's demeanor remained calm, but his eyes told a different story. He wasn't used to being treated like this, especially not in a hospital. After a long pause, he sighed and removed the hat, handing it to Kelly without a word. "Fine," he muttered. "I'll take it off. But trust me, you're going to regret this." The incident didn't just stay within the walls of Willowbrook. It quickly spread like wildfire across social media. Within hours, news outlets picked up the story, and the hospital found itself in the midst of a public relations nightmare. The Rock, after all, was not just a beloved actor and former wrestler. He was a global icon, with millions of followers on social media. His every move was scrutinized, and his words carried weight. The public response was immediate and polarized. Supporters of Kelly and the hospital's inclusive policies rallied behind the decision, arguing that it was essential to maintain a neutral, welcoming environment in healthcare settings. After all, a hospital was supposed to be a sanctuary, a place where people came to heal, not to engage in political debates. On the other hand, many came to The Rock's defense. They saw Kelly's actions as an overreach, an example of cancel culture at its worst. For them, The Rock's MAGA hat was a personal choice, one that shouldn't have been cause for conflict. They pointed out that he was a man who had built his career on inspiring people, regardless of their background, and that he wasn't there to make a political statement. Yet the fact remained, Kelly had asked him to remove the hat, and now the fallout was unfolding. Despite the public uproar, The Rock remained calm. He took to his Instagram account, which had over 250 million followers at the time, to address the situation. In a heartfelt video, he explained his side of the story. "Look, I understand why people are upset," he began, his voice heavy with sincerity. "I never meant for my hat to cause any harm. I never meant for it to upset anyone. But what I want people to understand is that it's not about politics for me. It's about my father." The Rock paused, his usually confident demeanor softening. "When my dad was diagnosed with cancer, he was treated like an outsider in the healthcare system. No one listened to him. No one saw him for who he was. And I promised myself that I would fight for a better system. That's why I wear this hat. Not because I believe in a political party, but because I believe in fighting for change." The video went viral. It wasn't the message anyone expected, and it forced many to rethink their stance on the controversy. What had started as a political statement became a deeply personal story of family, struggle, and resilience. The Rock's vulnerability struck a chord with millions, and suddenly the conversation wasn't about a hat. It was about a man's fight to make a difference in the world. As The Rock's message spread, the narrative around the incident shifted. People who had initially criticized his actions began to see him in a new light. His story of personal struggle resonated with so many, and the hospital found itself facing an unexpected dilemma: how to reconcile its commitment to inclusivity with the broader values The Rock had just shared. Inside the hospital, tensions were rising. Nurses, doctors, and staff members who had supported Kelly's decision to enforce the policy now questioned whether they had acted too hastily. A series of internal meetings were held, with staff members debating the fine line between upholding hospital rules and respecting personal beliefs. Could they still enforce the policy without alienating patients and visitors? Were they, in some ways, contributing to the very divisiveness they sought to avoid? Meanwhile, Willowbrook's leadership began to discuss how to address the backlash. Some board members pushed for a public apology, while others argued that the hospital had done nothing wrong. The media continued to stoke the fire, and soon it wasn't just about The Rock. It was about healthcare reform, personal freedoms, and the importance of listening. In a move that shocked many, Willowbrook reached out to The Rock and invited him back to the hospital for a public discussion about inclusivity, healthcare reform, and the importance of empathy in healing. The goal was to bring the community together, to start a dialogue about how to create spaces that respected both personal beliefs and shared values. The event, which was held in the hospital's largest auditorium, was packed. It wasn't just staff and patients who attended. The media was there, as well as local leaders and advocates for social change. Kelly Thompson, still firm in her beliefs, was seated next to The Rock on stage. The conversation began uneasily, but as both sides shared their perspectives, something unexpected happened. Kelly acknowledged that, in her zeal to enforce the hospital's policies, she had overlooked the deeper meaning behind The Rock's message. "I was so focused on the rules that I didn't take the time to understand where you were coming from," she said, her voice softened by a sense of humility. The Rock nodded, his expression warm. "I get it," he said. "It wasn't your fault. But I think the key to moving forward is recognizing that we all have our own stories, our own battles. It's not about agreeing on everything. It's about listening to each other." As the event continued, both Kelly and The Rock shared their ideas for how to make Willowbrook a more inclusive, empathetic space. The Rock pledged to work with the hospital on a new initiative to address healthcare disparities, particularly for those who felt marginalized by the system. His message was clear. Real change came from understanding each other's experiences, not from drawing lines in the sand. The incident at Willowbrook was ultimately a turning point for the hospital. It led to a series of changes that rippled through the entire institution. Willowbrook launched a diversity and inclusion initiative that focused not only on race and gender, but also on political and cultural sensitivities. It became a model for hospitals nationwide, showing that even the most contentious issues could lead to growth and improvement. For Kelly, the experience was a reminder of the importance of empathy in leadership. She had learned that policies were necessary, but they should never come at the expense of understanding the people behind the rules. The Rock had taught her that true healing came not just from treating the body, but from connecting with the heart. As for The Rock, his journey continued. His personal story had sparked a national conversation about healthcare reform, but he remained grounded in his mission to fight for better care for everyone, regardless of their political beliefs. The MAGA hat, once a symbol of division, had become the catalyst for a broader conversation about change, empathy, and the power of listening. In the end, the confrontation at Willowbrook didn't just shake the hospital. It changed it for the better, leaving a lasting legacy of understanding, compassion, and the belief that change could come from the most unexpected of places. The unexpected meeting between Kelly Thompson and Dwayne "The Rock" Johnson had created a ripple effect far beyond Willowbrook Medical Center. What started as a contentious dispute over a MAGA hat quickly evolved into a moment of profound introspection, not only for those involved, but for the entire community. The hospital, initially caught in the crossfire of an intense political and social debate, found itself at the center of a larger movement. A movement aimed at breaking down barriers, healing divisions, and bringing people together. The dialogue that began in the hospital auditorium continued to resonate across the nation. The media coverage of The Rock's vulnerability and his commitment to reforming the healthcare system sparked conversations in living rooms, boardrooms, and legislative chambers. People from all walks of life began to examine their own roles in perpetuating division, and many found themselves reassessing what it meant to be truly inclusive. The MAGA hat, which had initially been seen as a symbol of divisiveness, had evolved into a symbol of a much deeper, more personal struggle, one that transcended politics. At Willowbrook, a new initiative was born. In collaboration with The Rock, the hospital launched the Healing Beyond Boundaries program, a groundbreaking initiative aimed at addressing the systemic inequalities in healthcare, with a focus on empathy, understanding, and open dialogue. The program was designed to provide education and training for healthcare professionals on how to navigate sensitive topics, political differences, and cultural complexities with respect and compassion. It sought to create an environment where patients felt not only cared for, but truly seen and heard. The Rock's involvement in the program was instrumental. With his global platform, he was able to reach an audience that most healthcare leaders could only dream of. His public endorsement of the program was a game changer, and soon hospitals across the country began to take notice. The initiative's message was clear. Healthcare wasn't just about treating the body. It was about treating the whole person, mind, body, and soul. As the Healing Beyond Boundaries program gained momentum, something remarkable began to happen within Willowbrook itself. Staff members who had initially been divided over the incident started to unite behind the common goal of making the hospital a place of true inclusivity. Nurses, doctors, and administrators who had once viewed each other through the lens of their professional roles began to see one another as human beings with their own struggles, beliefs, and stories. Kelly Thompson, whose decision to enforce the hospital's policies had sparked the initial conflict, found herself undergoing a transformation of her own. She had always prided herself on being a strong, decisive leader, but after the incident with The Rock, she began to see leadership in a new light. It wasn't about being right. It was about being compassionate. It wasn't about enforcing rules. It was about fostering understanding. Her conversations with The Rock had left a deep impression on her, and she found herself reflecting on the power of empathy in leadership. The Rock, for his part, had not only become an advocate for systemic healthcare reform, but also found a sense of personal healing. For years, he had been the face of strength and resilience, a symbol of perseverance in the face of adversity. But through his involvement with Willowbrook, he was finally able to reconcile his past, especially the pain of seeing his father suffer in a healthcare system that often overlooked the most vulnerable. The conversations he had with Kelly and the connection he forged with the hospital staff allowed him to heal in ways he hadn't expected. For Dwayne Johnson, the path to healing wasn't just about addressing the political or social issues at hand. It was about coming to terms with his own experiences of pain, loss, and disillusionment. His vulnerability had become his strength, and it was through sharing that strength with others that he began to see the true power of healing. It was not something that could be achieved alone. It required a community. It required understanding. It required listening. As the Healing Beyond Boundaries initiative continued to expand across the nation, it sparked a larger conversation about healthcare reform and the role of empathy in the treatment of patients. The media coverage of Willowbrook's groundbreaking program began to shift the narrative away from partisan politics and toward a focus on the human experience of healthcare. Doctors, politicians, and activists began to speak out in support of the program, acknowledging that while the American healthcare system had made significant advances, there were still deep, systemic issues that needed to be addressed. Disparities in access to care, the treatment of marginalized communities, and the overwhelming burden placed on healthcare workers were all topics that began to take center stage in public discourse. The ROC's involvement in the initiative helped to break down some of the partisan barriers that had long existed around healthcare policy. While he had once been seen as a political outsider, his ability to connect with people from all walks of life gave him a unique perspective on the importance of finding common ground. His message, which had initially been misunderstood, now resonated with a wider audience. People were starting to understand that the political divide was not as important as the human connection that could be forged when people put aside their differences and worked toward a common goal. Healthcare professionals nationwide began to adopt the principles of the Healing Beyond Boundaries program in their own practices. Medical conferences and seminars were held to discuss how to integrate empathy and understanding into patient care. Hospitals, once focused solely on medical procedures, began to prioritize the mental and emotional well-being of their patients as well. The Healing Beyond Boundaries program not only transformed Willowbrook Medical Center, but also sparked a ripple effect that spread across the country. Hospitals, healthcare organizations, and even insurance companies began to take a closer look at how they could improve their services by focusing on the emotional and psychological needs of their patients. The Rock, having witnessed the impact of his involvement, continued to champion the cause of healthcare reform. He used his influence to push for policies that would address the root causes of health disparities, particularly in underserved communities. Through his continued advocacy, he was able to secure funding for new programs aimed at improving access to care for those who had long been excluded from the system. His work helped to shine a spotlight on the importance of mental health, the impact of trauma on physical well-being, and the need for greater diversity in medical research and healthcare leadership. One of the most notable achievements of the program was the establishment of the Rock Foundation for Healthcare Equality, a nonprofit organization dedicated to improving healthcare access for marginalized communities. The foundation worked closely with Willowbrook and other hospitals to provide resources, education, and support to those who had long been neglected by the system. Through his foundation, The Rock also funded scholarships for young people from disadvantaged backgrounds who aspired to become healthcare professionals. He knew that lasting change could only come when the next generation of doctors, nurses, and medical leaders was empowered to make a difference. The ripple effect of the Healing Beyond Boundaries initiative continued to grow, touching countless lives in ways that no one had anticipated. It became clear that the power of empathy and understanding could transcend political and social divides, and that true healing required more than just physical care. It required a deep, unwavering commitment to seeing each person as an individual with their own unique experiences, struggles, and hopes for the future. As the program continued to evolve, one thing became clear. The true power of the initiative lay not in the recognition it garnered, but in the unity it fostered. What had begun as a divisive moment between Kelly Thompson and The Rock had transformed into a force for good, transcending the political tensions that had once seemed insurmountable. In the months following the launch of Healing Beyond Boundaries, the hospital staff, once divided over the initial incident, became a unified force working together to ensure that the principles of empathy, respect, and understanding were woven into every aspect of patient care. Kelly Thompson, who had once been seen as the enforcer of hospital policies, became a passionate advocate for the program. She worked tirelessly to integrate its core values into every department and encouraged her colleagues to embrace the power of listening and empathy in their interactions with patients. Dwayne "The Rock" Johnson continued to lead the charge, using his platform to advocate for a more compassionate healthcare system. His willingness to be vulnerable, to share his own story and to learn from others became the cornerstone of the initiative's success. His message of unity and empathy resonated deeply with people from all walks of life, and his advocacy work was seen as a catalyst for a much-needed transformation in the healthcare industry. Together, The Rock and Kelly led a movement that changed not only Willowbrook, but the entire healthcare system. It was a movement rooted in the belief that when people come together with empathy and understanding, even the most contentious issues can be overcome, and true healing can take place, both in the body and in the heart. Years after the launch of the Healing Beyond Boundaries program, the impact of Willowbrook's transformation was still being felt across the nation. The program had become a model for hospitals everywhere, a beacon of hope for those who believed that healthcare could be more than just a series of treatments and procedures. It could be a place of connection, compassion, and healing on a deeper level. Dwayne "The Rock" Johnson's journey from celebrity to advocate for systemic healthcare reform had not only changed the course of his own life, but it had also changed the lives of millions. Through his work, he had inspired a generation of healthcare professionals to prioritize empathy and understanding in their care, and to see their patients as whole individuals deserving of respect. As for Kelly Thompson, her leadership had evolved into something truly extraordinary. She had gone from enforcing rules to championing a cause that was bigger than any individual. She had become a symbol of change, not just for Willowbrook, but for the healthcare industry as a whole. Together, they had proven that even in the face of division and adversity, it was possible to come together, to listen, and to create a system of care that honored the humanity of each person. The legacy of Healing Beyond Boundaries was one that would continue to inspire change, not just in healthcare, but in every sector that sought to build a more compassionate and inclusive world. The Rock's final words in his last public speech on the initiative encapsulated the heart of the movement. True healing starts when we listen, when we understand, and when we come together, not as individuals, but as a community. We are all in this together. The journey that began with a MAGA hat and a misunderstanding at Willowbrook Medical Center blossomed into something far greater, a profound reminder of the power of empathy to bridge even the deepest divides. Dwayne "The Rock" Johnson and Kelly Thompson, two people from seemingly different worlds, showed what could happen when people chose dialogue over discord, humanity over hostility, and understanding over assumptions. The Healing Beyond Boundaries program was not just a policy initiative. It was a testament to the belief that every human being, regardless of their background or beliefs, deserves dignity, care, and compassion. Through the program, hospitals transformed from sterile institutions into sanctuaries of connection and healing, proof that the healthcare system could evolve to meet not only the physical needs of patients, but also the emotional and societal challenges they faced. Dwayne Johnson's role extended far beyond his celebrity status. He became a living example of the courage it takes to be vulnerable, to stand up for unity, and to lead by example. His message of compassion resonated across the nation, inspiring communities to rethink what it means to truly care for one another. Kelly Thompson's growth as a leader reminded us that change often begins with self-reflection. Her journey from rule enforcer to compassionate advocate symbolized the transformative power of humility and empathy in leadership. She became a beacon of hope for her staff, proving that even in the most challenging moments, people have the capacity to grow and lead with grace. Years later, as Willowbrook Medical Center stood as a national symbol of healing and progress, the story of that one day, that one hat, and that one chance meeting continued to inspire. It became a story passed down in classrooms, discussed in leadership seminars, and celebrated in healthcare reforms as a pivotal moment in the fight for unity and equality. In a world that often feels fractured and polarized, this story reminds us that connection is always possible. True change doesn't come from silencing others, but from listening, truly listening, and finding the humanity in those we might otherwise misunderstand. The legacy of Healing Beyond Boundaries is a challenge to us all to choose compassion, to build bridges instead of walls, and to create spaces where everyone feels seen, heard, and valued. It is a call to action to heal not just our bodies, but our hearts and our communities, one act of understanding at a time. And so the story ends not with a final resolution, but with an open invitation for all of us to step forward together into a future shaped by empathy and united by hope. Thank you so much for taking the time to listen to this story. Your support and engagement mean the world to us. If you enjoyed the story and found its message inspiring, we'd really appreciate it if you could take a moment to like this video and share it with your friends or anyone who might need a little inspiration today. And don't forget to subscribe to our channel for more thought-provoking stories, lessons on empathy, and tales that spark meaningful conversations. Hit the notification bell so you never miss an update. Your feedback is incredibly important to us, so feel free to leave a comment below with your thoughts. Let us know how this story resonated with you, and if you'd like to hear more stories like this, we'd love to know. Once again, thank you for being part of our community. Together, we can spread positivity, kindness, and understanding, one story at a time. See you in the next video.